All right, it's that time again, the practice questions, but now for diabetes. So, question number one. The nurse is caring for a client with type 1 diabetes mellitus. When asked by the client why she's so thirsty all the time, how should the nurse respond? So, go ahead and pause the screen and try your best to answer this question in about 60 seconds or less. All right, so let's break it down following the question breakdown strategy. So, number one, we first look at the key terms in the question. So, the question states type 1 diabetes and so thirsty all the time. Now, number two, always think of a few things you know about those key terms. So, remember, diabetes, think diabetes. There's a lot of sugar within the bloodstream as the body lacks insulin to help put that sugar into the cell with insulin in type 1 diabetes. So when glucose is uncontrolled, this is hyperglycemia. Basically, the blood is turned to thick, syrupy mud. So just think very thick, sugary blood. Now, this causes a lot of fluid shifts as the body is trying to urinate out all that high sugar from the body and into the body, making the body very dry. Okay, now let's look at the options here. So option A, osmotic fluid shifts cause excessive urine output and leads to dehydration and thirst. Yes, this would be the most correct here. The increased osmolality within the blood, basically fancy words for blood thickness, causes fluid shifts within the body to balance or dilute that thick, sugary blood. And excess urination leads to dehydration and thirst. Now, option B is incorrect here. Increased blood glucose levels decrease serum osmolality and trigger thirst receptors. No, this is furthest from the truth. Increased blood sugar actually increases the osmolality, that blood thickness, not decreases. Now, option C, also incorrect. Due to your insulin deficiency, your cells become starved, causing increased appetite and thirst. Now, this was very close, but it's incorrect. Now, it's true that the cells do become starved from lack of glucose entering the cell, because remember, without insulin, there's no help to get sugar into the cell, but it doesn't account for the thirst. And lastly, option D is also incorrect. Due to your resistance to insulin, metabolism and nutritional requirements are increased. No, this is totally incorrect. Type 1 diabetes, the body attacked the pancreas, resulting in decreased production of insulin. So this option describes type 2 diabetes, where the problem is you, the diet, lifestyle, and a little genetics. So type 2 is the one that has insulin resistance from the overuse of insulin receptors. Now, moving on to question 2. The nurse is preparing to administer subcutaneous insulin to a client with hyperglycemia. The nurse will monitor the client's lab work closely for which electrolyte imbalance related to insulin administration. So pause the screen and try your best to answer this question in about 60 seconds or less. All right, let's break this question down. Following the question breakdown strategy. So number one, first look at the key terms in the question. The nurse will monitor for which electrolyte imbalance related to administration of insulin. So second, always think of a few things you know about those key terms. So remember, insulin puts glucose and potassium into the cell. So potassium is the big electrolyte to monitor for, specifically hypokalemia, that low potassium, as potassium is going from the blood and into the cell. So option D would be the most correct. Now for question 3. The nurse is assessing a diabetic client 1 hour after administration of a dose of subcutaneous insulin. Which findings alert the nurse that the client may be experiencing hypoglycemia? So pause the screen and try your best to answer this question. All right, let's break it down, following the question breakdown strategy. So once again, first look at the key terms in the question. 1 hour after insulin administration, which findings of hypoglycemia? So again, number 2, think of a few things you know about those key terms. specifically hypoglycemia. We have to think low blood sugar. So think cool, pale, sweaty, shaky, and clammy. Give that client some sweet juice or some sugary candy. Or just use the memory trick high wash. Okay, now that you have that, then look at the options. So option A, reports of hunger and excess urination. No, this is incorrect. This is typical of hyperglycemia, that high sugar, as the body tries to urinate out all that excess sugar from the body and into the potty. Now, option B, tachycardia and new restlessness. Yes, this is the most correct. Remember, tachycardia is that fast heart rate over 100, and new restlessness, as clients typically get anxious and tremble from that low sugar. Now, option C is incorrect. Elevated body temperature and agitation. No, clients get cool and clammy and also sweaty. Not hot here with that elevated body temperature. But the agitation is correct. Now, option D, bradycardia and fatigue. No, not the low heart rate, but rather tachycardia with low sugar. Now for question number 4. When asked by the new graduate about the etiology of type 2 diabetes mellitus, how does the nurse respond? So once again, pause the screen and try your best to answer this question. All right, so let's break it down following the question breakdown strategy. So number 1, we look at the key terms in the question. Etiology is just fancy words for cause of type 2 diabetes. And number 2, we always think of a few things you know about those key terms. So remember, type 2 is a you problem. Your diet and sedentary or sitting lifestyle, and a little bit of genetics. So remember, the cells become resistant to insulin from overstimulation, typically from consuming way too many simple sugars, or basically sugary foods. The cells are kind of like an overused key lock, where insulin doesn't work effectively any longer to get that sugar into the cell. Okay, now look at the options here. So option A, type 2 diabetes mellitus results from a resistance to circulating insulin. Yes, the key term there is resistance to insulin, or in other words, insulin resistant. Now, option B is incorrect. Clients with type 2 diabetes mellitus require lifelong subcutaneous insulin replacement. No, this is furthest from the truth. This is for type 1 diabetes, since clients are born with type 1. It's an autoimmune disorder where the body attacks the pancreas, so the pancreas does not produce insulin. Now, option C, type 2 diabetes mellitus is an autoimmune disorder. No, once again, this is type 1 diabetes. And option D, type 2 diabetes mellitus results from surgical removal of the pancreas. Wait a minute, what? No, this option is wild. We do not remove the pancreas in either diabetic conditions. Now lastly, question number 5. The nurse is providing education to a 50-year-old client with newly diagnosed type 2 diabetes mellitus. Which will the nurse include in the teaching? So once again, pause your screen and try your best to answer this question in about 60 seconds or less. All right, so let's break this question down following the question breakdown strategy. Remember to do this first before looking at the options. So remember, number 1, we first look at the key terms in the question. So education to a client who is newly diagnosed with type 2 diabetes. What will be included in the teaching? And number 2, think of a few things you know about those key terms. So remember, with type 2, the problem is you, your diet and sedentary lifestyle, as well as a little bit of genetics. And it can be managed by you, a low glycemic, high fiber diet, and an active lifestyle. So option A, type 2 diabetes will be managed entirely with subcutaneous insulin. No, this is incorrect. It actually can be managed with diet and exercise. And option B, feelings of excess hunger and thirst mean that blood sugar has dropped. No, totally incorrect. This typically means blood sugar has increased and not dropped, resulting in hyperglycemia, causing the body to desire fluids to dilute that high sugar inside the blood as well as the body trying to urinate it all out from the body and into the potty. Now, option C, low blood glucose is best treated with high sugar and fatty snacks like peanut butter, crackers, and whole milk. No, this is completely incorrect. We actually want to avoid those fatty foods and go with simple sugars during low blood glucose. So we want to give orange juice, fat-free milk, and candy, since fat slows down the absorption of sugar. Now, option D is correct here, so listen close. Proper diet and exercise can reduce the signs and symptoms of type 2 diabetes mellitus. Yes, the key term here is type 2. Remember, type 2 is a you problem. So reduce the signs and symptoms by changing your diet and exercise. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos.